Okay, so I am going to tell you guys just a little bit about how this happened. It will be a long video, and if you are not okay, just trying to be straight up, if you are not okay with listening to words like uterus, fallopian tubes, ovaries, breast, blood, breast milk, I think that's infertility, fertility, hormones, then you don't want to watch this. You should just stop watching. And if I'm looking over to the side, I've got my mom over here, so she can help me remember or tell me something if something isn't, all the steps aren't correct. So she said she didn't want to be on national TV, so we're gonna leave her off of the video. My mom has been, I don't even know words. She immediately, soon as she found out, which was only on January 9th that all of this started, it feels like eons ago, she found out and she quit her job immediately, and she has been here to help us with everything, especially since the hysterectomy. I cannot pick up Kaya, who is like 23 pounds, which is a little more than a gallon of milk. So I can't pick her up for 6 weeks after hysterectomy. And then my in-laws came in. They are wonderful, wonderful, wonderful. And then my mom let us take over her house most recently. So, don't even have words for how thankful I am. Do you want to be on national TV now?
No, thank you.
So, all right. Okay, so when I was 7 months pregnant, okay, back up. So when we were trying to get pregnant, we were not able to do so without fertility assistance. So we went to an amazing reproductive endocrinologist at Texas Children's, where we both worked. And we were able to get our 3 beautiful babies, and everything went really well. They do tons of testing, lab work and scans, and I mean, you are tested up before you get a like psych check, like you do a lot of stuff, genetic screening, like all the things. So anyways, we'll come back to that. So we got our 3 beautiful babies, which I would never change 1 second of. And I'm so silly. I was like, oh, well, that's my thing, because that's my testimony, because God gave us these 3 beautiful babies, and we really had to work on our patience and our belief and our faith in God through that. Through that, we also had a miscarriage, and absolutely had to work on our faith through that. There was 2 embryos that we lost. And so I was like, well, that's part of my testimony. So apparently that didn't end with that. So when I was 7 months pregnant with my last baby, with Kaya, at 7 months, which would have been around March-ish of last year, I felt a bump in one of my breasts. So I didn't think much of it. It was like a little smaller than a marble size. It absolutely felt like a clogged milk duct, or a milk duct even. I mean, it was small. It was small. Marble size is probably way too big, but it was very small. And so I didn't think much of it, because it was, again, my third baby. I breastfed all of them. So maybe my body's responding more quickly. That happens. So at birth, I told my OB, hey, there's this spot. What do you think? It hasn't changed. She asked if it had changed. It has not changed. Do you think it's a milk duct? And of course she's like, well, probably, but let me know if it changes. Very appropriate response. Because my family history, from what we ask when as providers and what we're asked of as being the patient, is only what happened to you in your health history and then what happened to siblings, what happened to your mom and dad, and what happened to their grandparents on either side, right? Maternal grandparents or paternal grandparents. And that's all we ask. So if anyone asked me that through fertility or through my OB or any other human, I didn't go further because one, I had been trained that that's all we ask for. That is appropriate. So she said, let me know if it changes. And I said, yeah, absolutely. As time went on, it did not feel like it changed. It stayed. It did not feel like it changed in the least. In fact, I felt like I could put as a breastfeeding woman, you put warm compress on a milk duct and it'll unclog. And I absolutely felt like it would go down. So I was super reassured. Nothing at all. There was no other symptom at all. I breastfed all 3 of my babies. For Eli, we were able to make it to 11 and a half months before I couldn't completely breastfeed him by himself. For Desi, we were able to make it a little bit of shorter time where I didn't have to add in formula to supplement. And then with Kaya, planned on doing it as long as possible. But she, when we got back to daycare, when I got back at work, the kids got sick, which we all know that happens, especially the first year they're back in like school or daycare, right? And so the family always got it. And Kaya happened to be the ones bringing it home. And so she would be the first to get flu and COVID and an upper respiratory infection that never left. So we were sick. The entire family was sick for literally 6 weeks solid this fall. So when that happened, my milk was much, much less. Kaya was 5 months, the youngest I've ever stopped breastfeeding. I tried everything I could possibly think of. I got different people. I mean, we did all the things. And it just wasn't cutting it. So we started formula. And so as a breastfeeding mom, your breasts, when you are breastfeeding, are more supple. They have more volume because you have milk in them for a baby that you're growing with your own body. So when I stopped breastfeeding, the volume went down as it does, and the knot was much larger. I mean, the knot was probably like this and this, I would say. So that wasn't normal. And so I told my PCP about it. She said, well, let's just get a mammogram. I'm 39, guys. The place that you get a mammogram is 40. Women get a mammogram at 40. If your own mother or you have a strong family history of breast cancer, they may do something a little earlier. And if your own mother has breast cancer, then what they recommend is whatever time your mom had breast cancer at, you get a mammogram 10 years before. That's it. You start mammogramming 10 years before. So I'm 39, and I didn't have any that I knew of, like significant family history. And so we got the mammogram back, and it came back as BI-RADS 5. BI-RADS is the grading system that they use for mammograms. So it goes up, if you will. I mean, I'm not gonna pull it up. You can pull it up, but BI-RADS 5 is like something ridiculous, like 90 or 99%. Like it's something, I think it's 90% of BI-RADS 5 will have cancer. So we knew, and my PCP, who is absolutely a phenomenal human, she called me on a Saturday morning at 8 o'clock. I was at my in-laws. It was like a week before Christmas. And she said, hey, this was going on. And I mean, of course we were concerned, but not that concerned. I'm 39. I just felt this, I wasn't that concerned. I mean, I was concerned, of course, to do the things that they recommend, absolutely, but never in my life thinking it would lead to a terminal diagnosis. So they automatically, I was at Kelsey-Seybold, they automatically did all the things, got me hooked up with the breast center, and we were going to have all the things. We were going to go in, you have to get a better mammogram where they can get more images, zoom in a little bit more. You have to get a diagnostic mammogram, I think, and then you have to get a diagnostic ultrasound, and then they also will do a biopsy of the area to see which also it goes into your lymph nodes. So you have women have breast tissue that goes into their axilla, their armpit. Okay, every woman does. It's normal. And so the ultrasound will look at that as well, because that would be the first site of metastasis if the cancer were to spread. So we had it all planned out at Kelsey-Seybold. My sister just happened to have another young lady that she knew in the last year that had a wild breast cancer diagnosis. Hers was, she had gone through MD Anderson and she had done the thing. So if you are under 40, they will automatically do radiation for like 5 months, and then I'm sorry, I'm lying. Scratch that. They do chemo for like 5 months-ish, depending on how you respond, and then you get a mastectomy usually, and then you will get a radiation treatment, especially if you're premenopausal. Apparently within the last few years, they changed that to where everyone doesn't need radiation, but especially if you are premenopausal, you will absolutely get radiation. So we had it over. This lady said to my sister, your sister needs to get into MD Anderson. They have an undiagnosed breast cancer clinic that has all the things. So, I mean, we went there. Kelsey-Seybold was amazing. We went to MD Anderson. So I immediately got it changed over. So our testing was on December 30th. So December 30th, I went in, had the mammogram zoomed in. Diego went with me, but when you're in the back, the men are not allowed in the back because it's a lot of ladies that don't have their shirts on, right? It's like gowns. So they don't let men in the back. So the whole day he's sitting out there and I'm sitting in the back. And our appointment was something ridiculous, like 8 o'clock in the morning. We didn't leave that day till 4:45 or 5:30. Like, that's not great. You know, something's up. So we did a ton of pictures on the mammogram. We did a ton of ultrasounding. Like, the ultrasound was like an hour and a half. I just kept telling myself they're ultrasounding because I'm having a baby. Like, I had to psych myself out because it was so long, and I could see the things that she was looking at, and I was like, that's not normal. But it's totally out of my scope. I don't do breast. You have a mammogram, we'll do the next steps, but I don't do the imaging. I don't do any of that. So then we go into biopsy, which we knew that day, if we see something, we're going to biopsy it. If they see a lymph node, they're going to biopsy it. They went to biopsy this spot that I went in for that was found on mammogram as well. And it was in a weird place because it was so far back in my breast that, and smallish, way smaller than the area that what I was feeling. And so everyone was concerned because there's things called calcifications in the breast that women can get that are absolutely normal a majority of the time. My calcifications in my breast were measured, which I had no idea of, because younger women's breasts are more dense, so they will feel more dense. So the calcifications, it's hard, it's easier to hide, right? You can't feel it as easily. So the calcifications span like 12 centimeters. It was across my entire upper left breast. Had no idea. So the radiologist was great, and she couldn't get to it. So she's like, I'm not going to keep poking around on you, but we found another spot in a different quadrant of your breast. And so we're going to biopsy that. And then there's a lymph node we're going to biopsy. They also have a cell specialist come in during that time, and then they whisk the samples away to the back room real quick. And like within 5 minutes, they know if it's cancerous. And the radiologist was like, this is very concerning. That you have these types of calcifications, because mine were called pleomorphic microcalcifications. It's a fancy way of saying the calcifications are a bunch of different shapes, and we know that means cancer. So which I already thought I knew that, right? I mean, we've got BI-RADS 5. So and they're like ultrasounding me for an hour and a half. So I was like, okay, because I was set, like, okay, yeah, this is scary, but I'm in healthcare, we're gonna do the things. So she comes back in and she's like, honey, you have cancer. She was like, we cannot biopsy it today. And I was like, I was concerned because there was a holiday in between and I knew that was going to increase the timing. And she was like, I will get it moved up. I will make sure that you have your biopsy next week. So, but the cells came back within like 5 minutes, like ridiculously short amount of time, that they were cancerous and abnormal, massively cancerous and abnormal. So that was that. And we went home. And then we had a follow-up biopsy, right, of the initial place. And that was on the January 5th, after the holidays. And so when we did that, you have to do this, oh my gosh, I'm going to forget what it's called, but there's a special ultrasound that you do, and you lay on a bed and you literally put your breast through the table and you're really high up. I don't even know how they do this because most of these women are like 70, 80. I have no idea how they're like walking up the ladder, but it's literally a ladder like from Home Depot. And you walk up to a regular bed like that you would see for any procedure, like not a hospital bed, but one of the imaging beds. And you put your breast through this hole, massive hole, and I had the procedure done and had the most amazing radiologist in there doing it as well, a different lady, and she had all kinds of knowledge and again, very concerned. And so we know this isn't going really well, right? So then we got the results back of that and set up immediately with MD Anderson's oncology department, as well as their breast surgeon. I was going to go, and I had a meeting with them in the Woodlands, and because I just wanted the fastest. Who's the fastest? Who's the fastest? Yes, we want the best, but who's the fastest so I can just get in there and get these things started. Then we can like move around as we need to a different group if this isn't great. Anyways, I looked up all this stuff and it looked amazing. The breast surgeon was phenomenal. The oncologist left a lot to be desired. So the breast surgeon, I mean, just phenomenal. And so he was at like 8 a.m, and then the next appointment was at like 3:30. And so we went and did some fun things with a friend, and then saw her babies, and then we went back to the oncologist. And the breast surgeon told me when the oncologist sees you, they navigate your care, okay? So your most important appointment today is the oncologist. And I was like, okay, because we'll decide like chemo treatment, right? And what are we going to do? What are we going to start? And I'd already known like the track because the breast surgeon just told me. So I'm like, okay, like I'm going to get a port. And so I looked in the mirror at MD Anderson that day in between the appointments, and I was like, oh, it's going to suck, right? I'm going to look in the same mirror when I'm coming here for the billion chemos or whatever it is, the imaging and re-imaging and all the things that go into the horrible diagnosis of breast cancer. And I'm going to see a girl with a port with no hair, that's probably pale and anemic because that comes along with it, that has to wear a mask everywhere and is maybe has no breast because I've had my mastectomy, and then has radiation. So you have like a skin burn, like that from the radiation site mostly. So then we went to the oncologist appointment. The oncologist essentially left us with, you have a terminal diagnosis. I asked how many years. She's like, this is not treatable. This will be, you have about 3 to 5 years, 7 years at best. And our whole world the only thing that I'm thinking of is the baby San Diego. Because so Kaya would be 3 if it goes well, right? If I don't get some weird cold that attacks my system differently. And she told us that my bones were so brittle, like, because she didn't say that. Back it up. Sorry. I'm getting it mixed up. So she said you have 3 to 5 years, 7 years at best. We've got these medications. And we were like, okay, what do we do? Like, is there anyone we can talk to? Because what she told us is we're going to get a CT scan. And the reason she said all this is because there was a biomarker in my blood, like CBCs, CMPs, those are all like your basic stuff that you look at all the time. Totally normal. And then she got a tumor marker lab called like CA51, and normal metastasis for that is 60. Like if you get a 60, then you know that it's metastasized. Mine was 1,000. So she's like, I think that this cancer is actually all in your bones and in your liver and your lung, because that's where breast cancer goes. And I was like, is this so rare? Like, how does this happen? She was like, it's not rare. She said, it's uncommon. She said, but this happens. Like, people your age come in, they had no idea, and it's everywhere. So we, she said, we're going to get a bone scan tomorrow to see if it's in your bones. And then on Friday, which is 5 days away, we're going to get a CT scan. And I said, I'm not going to be able to wait 5 days to see if it's all over my body, and I'm like this terminal. And so who do we need to plead with? What do we do? And she goes, well, you're charming. She was like, just go down there and beg when you have your CT tomorrow. At the time, I was like, absolutely. I will do anything this woman says. She's well reviewed. She just told me that I will do anything. So, we left with that. She's like, this is good. She said, I don't know if you believe in a higher power, but that she had seen a lady come in with a nodule in her lung that she went to biopsy for, and it was gone. So pray. And then she also said, that I was like, are there studies? Are there things? And she was like, yeah, there's a lot of studies, not studies. What am I trying to think of? Trials that you can go and look up and let me know what you find. So we were flipping left that day with you're dying in 3 to 5 years, 7 years at best. That's if everything goes well. Pray and go look up your own stuff. And go beg. After processing everything a little bit, and then I had to come home and tell my mom and sister. I called them over to my house. This is what it is. And then after processing that for a few days, which thank goodness, the person at the CT was a normal human, and they said, well, let's just see if we can get you in without me even saying a word. So he was able to get me in. Otherwise, we would have thought that we got the bone scan results on Tuesday, and we would have sat with that all week thinking it was in my liver, my lungs, my every single organ, because that's what the lady said, right? So we got everything that day, thank goodness. And she called back, really. I mean, I sent a message on my chart, hey, this is done. So she would know it was done, and we would get results back if she could look out for it. And she called back and she said, surprise, it's not in any of your organs. That's really good. And she told us the day before that if it's not in your organs and it's only in your bone, we have more time. So maybe like 7 years, 5 to 7 years, and then like 10 years at best. So I'm like, okay, it's not in my organs. And she's like, well, yeah, but it's so in your bones that it is probably been here for a little while. She thought it had been here since I was 36 years old. And that what happened was when you're pregnant, you have hormones rage, right? When you're doing fertility, you have hormones rage. And so like you're given hormones to help your body when you're putting those precious embryos in so they can have a nice home. So, I mean, we were doing the right things. So she said, I think that what happened is that you had this at 36 because it's so in your bones. And then of course with the IVF and the pregnancy, which can happen, with the pregnancy hormones, it like lit it like up like a fire. Like it was like throwing gasoline on the fire. So you progressed it sooner than you would have. I want to stop right here because if my children ever watch this, I want them to absolutely know, this is why I haven't put this on here yet. I want them to absolutely know that they are our biggest blessing this had nothing at all to do with us wanting them or them being their fault ever. It's something that just happened. And what needs to be done from now on with all the testing, in my mind, in my heart, the thing that I will like take to the end is IVF women should flipping have into all of that cancer. Into all of the testing. We do so much testing. Why in the world would you not put IVF women and give them a mammogram if you're about to give them all of these hormones? It just makes sense, guys. It is not recommended. There are different studies that have shown recently that it does and it doesn't. How in the world does an estrogen positive, progesterone positive, HER2 negative breast cancer, how is that not ignited by hormones I was pumping into my body? What could have happened, guys, is at 36 years old, when I was going through IVF, I could have easily started. It's not the youngest ladies usually that are going through IVF, okay? So let's say if you're over 35 and you're getting IVF, we're gonna throw this into the mix because we know we're increasing your risk. But then a study came back last year, it says you're not increasing the risk. It makes zero sense. It just makes zero sense. We have to be increasing the risk, guys. And I feel like what they're saying is no, IVF doesn't cause breast cancer, but sure makes it faster. So Kaya, what we could have done, or with Desmond or Eli, what we could have done is had our precious embryos the whole flipping time. At that point in my life, it would have been so little on the mammogram. We could have gone and done a lumpectomy. We could have gone, which is like, that's it. Or if it went into my lymph node, we could have just done the things. We could have done chemo, and we could have done mastectomy, and we could have done radiation even. A year and a half later, could have put those precious babies back in, because your uterus, depending on the environment that you give it through your chemo, on different chemos, you can keep that absolutely working well. So we could have just done that, and my terminal illness wouldn't exist. So absolutely, I am advocating for women, all women, to get, we know that cancer is up like 300%, more 30 and 40-year-olds are being diagnosed with cancer than ever before. Why would we not give the over 35s just a mammogram? It's way cheaper, right, than paying for all my cancer stuff. So makes sense financially to the insurance companies. I just don't see how that's not something that is absolutely needed. So we do the things, and I realized later on, of course, that the first oncologist, like, I would never tell a patient to go beg for a life-changing test or study ever in my life. I would escalate it within my organization to get it done as fast as possible. We're based on acuity for everything in healthcare, right? So this girl has terminal cancer. Holy moly, let's get the scan and see how terminal it is. There's just some things in that meeting not going well for oncology, however, and it going disastrously, actually. And I've talked to patient advocacy, and I've talked to the lead of that department so that we can not complain, but save someone else for having that experience. Because apparently you never diagnose off of a tumor marker alone. So we were able to then go outside of the organization, find the most flipping phenomenal oncologist now, the most empathetic, rational human that tells it like it is, but absolutely does it with empathy and helps you get resources. And it's just been a great experience. We would have never sought after her if we had seen this girl's reviews and it hadn't gone so horribly. So we got the best of the best. I'm going to end this now so that we can make a different video so you guys aren't stuck here listening to me forever each time.